All right, welcome to the Explainer. Today we're tackling a really specific and actually surprisingly common nerve problem. We're talking about that strange pain, the one that can travel all the way from your neck right down into your hand. It's got a name, C7 radiculopathy, and we're going to unpack exactly what that is.
Okay, so let's just jump right in with a question. Does this sound familiar to you at all? That weird, maybe shooting or tingling pain, and it travels from your neck down your arm and lands right in your middle finger. If you're nodding along right now, well, this explainer is definitely for you.
So to really get a handle on that traveling pain, we've got to start right at the source, your neck. And it's so much more than just what holds your head up, right? It's really the command center for your entire upper body.
I love this analogy. Think of your neck like a super busy highway. You've got all these signals, basically messages from your brain, just flying down your spinal cord. And then they take these little exit ramps, these nerves, to control literally everything. Your arms, your chest, even your upper back. It's this incredibly complex and super important network.
All right, so if the neck is that highway, our whole story today, it really begins at one very, very specific exit ramp. Let's zoom in and see what's going on. And here it is. This is the official term, C7 radiculopathy. So what is it? Well, the C7 nerve root, that's our gateway. It's the nerve that pops out from your spine between the 6th and 7th neck bones. Now, when that nerve gets pinched or squashed or just plain irritated, that's when you get this condition. It's pretty much a major traffic jam on that nerve highway we were just talking about, and that jam causes a big backup of pain signal.
So you might be wondering, just how common is this specific problem? I mean, you can get a pinched nerve anywhere in your neck, right? But get this, the C7 nerve, it's the main culprit in more than 50% of all cases. It is by far the most common one to act up. Okay, so if that nerve gateway is blocked up, how does your body actually let you know something's wrong? Let's break down the warning signs, the ones that point right to that C7 nerve. The symptoms really create this super specific pattern. First, you've got that classic radiating pain, the tingling that goes down the back of your arm and wraps up in your middle finger. Second, you might notice some weakness. The C7 nerve is what powers your triceps muscles, so, doing a push-up or even just pushing yourself up from a chair might feel a little tougher. And third, you might get this weird, dull ache, either between your shoulder blades or sometimes even in your chest. It's because all these nerve pathways are, they're all connected. And we're not talking about just a simple, dull ache here. The way people describe it is so telling. They often use words like burning or electric. You can almost feel it, can't you? Those words really get to the heart of what nerve pain is like. It's a whole different ballgame than a simple pulled muscle.
So what's actually causing that nerve to get pinched? Well, it's interesting because the why often depends on your age. For younger folks, it's usually something sudden, like a disc herniation, maybe from an injury or lifting something the wrong way. But for older adults, it's often a more gradual story. Think degenerative changes, that sort of wear and tear arthritis that can happen over time. Okay, so that's the problem, but what's the solution? Once you know what's going on, what can you actually do about it? Well, the good news is there is a really clear path to relief.
The main goal is actually pretty simple and straightforward. You've got to relieve the pressure. That's it. So the whole focus of the conservative care we're looking at is to gently create more space around that angry, irritated C7 nerve. And at the same time, get the joints in your neck moving the way they're supposed to. So the source we're looking at lays out this really methodical, multi-step chiropractic approach where each step kind of builds on the last. First up, gentle adjustments to get things back in alignment. Then they work on the muscles and tissues around it to release all that tension. After that, they might use some gentle traction just to open things up and take the pressure off the nerve. And finally, and this is so important, it's all backed up with corrective exercises and posture coaching. That's the part that really helps build long-term stability and keeps it from coming back. But, the work doesn't just stop when you leave the clinic. What you do every single day plays a massive role in supporting your nerve health for the long haul.
And that brings us to nutrition.
Now, the source material goes into detail about a nutritional support strategy. And I just want to be clear, we're sharing this for informational purposes. It's not a direct recommendation. It mentions some specific formulas, things like one to help calm inflammation right at the nerve root, another to help the body handle stress. It also talks about things like high-quality omegas to help with overall inflammation and nerve repair, and even something to support gut health so you can absorb all those good nutrients. The whole idea is to create an internal environment that's perfect for healing.
And all of that ties perfectly into these everyday lifestyle tips. We're talking about things that might seem small, but make a huge difference. You know, paying attention to your posture, especially if you sit at a desk all day. Setting up your workspace so it works for you, not against you. Staying active with gentle stretching. And of course, managing stress, getting enough sleep, staying hydrated, and eating foods that fight inflammation. All of these are presented as just crucial pieces of the puzzle for both recovery and making sure this doesn't happen again.
All right, let's bring this all home. We've gone through the what, the why, and the how. So with all this information, what's the single most important thing to take away from all this?
Here it is. This is a huge piece of the puzzle. This is not, I repeat, not a life sentence for most people. The source suggests that with consistent, conservative care, this kind of issue can often be resolved in about 4 to 6 months. I mean, that's a really hopeful timeline, right? But it all hinges on one key thing.
And that one thing is acting early. The biggest takeaway here is simply this: don't wait. So I'll leave you with this final question. Are you really listening to what your body is trying to tell you? That weird tingle, that little bit of weakness you've been ignoring, it might not be just a random ache. It could be your C7 nerve sending out a warning sign, telling you it needs a little help.